The red, dry, itchy skin of eczema may be a lot more common in the summer than you think. With increasing temperatures, humidity, and smog, itchy, red, dry skin can be just as prevalent in summer as it is during winter months. According to a recent survey, over a third of Canadians surveyed say they or someone in their family has been diagnosed with eczema. In addition, 31% of Canadians who are not diagnosed by a physician report experiencing the three most common eczema symptoms: itchy, red, and dry skin. Dr. Charles Lind is a skin specialist in Toronto.
Eczema, or some people call it eczema, is often characterized by very itchy skin. The skin itself may be very dry, and it may actually be red and flaky. More commonly, it's found on the back of the hands, in the forearms and back of the knees, around the ankles, the legs, but it can in fact be everywhere on the body. Many times, however, when it's very itchy, it's red, it's inflamed, it's scaly, these are times certainly see a doctor, because oftentimes they can give you something more than just a regular moisturizer.
The question of diagnosing and managing eczema becomes even more important for parents with children sufferers, especially if your family has a history of allergies or asthma.
25% of the population in children have eczema. They often have this dry, irritated, scaly, itchy skin. Thankfully, we do have options now that we do have specialized cleansers, specialized moisturizers that can be used safely in children. It's very important for people with eczema to understand that there are often different triggers that can make their eczema worse. These triggers can vary from extremes of hot and cold. They can be from fragranced soaps. They can be from food allergens. They can even be from different bacteria that invade our skin.
A multi-level treatment approach is necessary for effective eczema management and can easily be remembered as the 4 R's.
The first R is to recognize the disease as being eczema, and this is by the dry, irritated, itchy skin that people may have. The second R is basically to remove, and this stands for basically removing triggers. Some of these triggers may be dirt, maybe bacteria on the skin, and this is often done by specialized cleansers. The third R is to restore the balance of the skin, and this is often done by different moisturizers. And the fourth R is basically to regulate the skin to prevent the flares of eczema that we may have, and this is often done by special medicated creams and lotions.
James has been living with eczema since he was a kid.
In addition to my medicated cream, I've also tried vitamin E and shea butter, but I haven't found that it has helped hydrate my skin long enough. So I've tried Eczema Care moisturizer, and it's really helped keep my skin hydrated longer.
For more information and treatment options for eczema, speak with your doctor or pharmacist. Sherry Damatarco reporting.